Hi everyone, thanks so much for joining. In today's webinar, we'll be looking at the impact of affordable housing, and more specifically, the impact that it has on employees and clients. We'll be opening up the lines at the end for questions and answers. Right now, we'll just go through a basic overview of how affordable housing impacts employees and clients. Now, the specific topics we'll be covering are as follows. First, we'll be looking at preventing chronic homelessness. Okay, that's sort of where affordable housing comes into play. And in addition, we'll be taking a look at spurring economic growth. And this is where affordable housing comes into focus as far as impacting employees and clients. Now, let's first take a look at why homelessness prevention should be addressed. So there are 2 points to this. The first point is that strategies to prevent new cases of homelessness or close the front door, quote unquote, to homelessness are as important to ending homelessness as services to help those who are already homeless re-enter housing. Prevention is just as important. In addition, point number 2, the challenge is targeting efforts towards those who will become homeless without preventive intervention. Now, why would we focus on mainstream programs? So first of all, people who experience chronic homelessness usually are heavy users of expensive mainstream services. In addition, most people who are facing homelessness, their levels of disability and poverty typically would make them very likely to be eligible for mainstream programs. And also, approaches that would typically work for this subgroup might make mainstream services more accessible for others. Now, prevention of chronic homelessness really involves identifying the key individual and system-level risk factors and then targeting prevention efforts to specific subgroups. So let's take a look at some of the risk factors for chronic homelessness. First, let's take a look at the individual risk factors, and then let's take a look at the system-based risk factors. So the individual risk factors are as follows. The first risk factor would be chronic health conditions, chronic mental illnesses, substance use, and other substance disorders. Typically, they have limited or no social support networks. Typically, there are domestic violence and other victimization or trauma-related factors. They've typically experienced family instability as a child, either out-of-home placement, family homelessness, or incarceration of a parent. And many times, this is an interesting one, many times there were combat experiences for veterans. Those are the typical individual risk factors of chronic homelessness. Now, system-based risk factors are as follows. If we look at the overall system, we'd see a lot of times there was either a discharge from jail, prison, hospital, a shelter, a detox program, residential substance abuse treatment, and foster care. In addition, there will be typically a lack of permanent affordable housing for those within this system. And also, they typically have very low or absolutely no income. Now let's take a look at some of the key prevention strategies. The first key prevention strategy is typically development, implementation, and monitoring of specific discharge policies, specific zero-tolerance discharge policies that would typically prevent homelessness. In addition, key prevention strategies would include access to supportive services coupled with housing. For example, either pilot programs for ex-offenders, in-reach housing assistance, and post-release support services. Another example would be creating or setting aside housing specifically for people either exiting mental health institutions or specifically for other at-risk populations such as the substance abusers or any other let's call it community that's subject either to the individual risk factors or the system risk factors. Now let's take a look quickly at the role of discharge planning in preventing chronic homelessness. So discharge planning linked to affordable housing and aftercare is a quote-unquote promising practice for the prevention of chronic homelessness, and particularly for people with health and behavioral disorders. Discharge planning is one of the methods that are gaining a lot of popularity in the prevention of chronic homelessness. Okay, and then we have discharge planning for people, people coming out of, discharge planning specifically for people that we've identified within the homelessness community that we've identified as having the individual/system-based risk factors. Now let's take a look at some data that the state of Massachusetts has published. Okay, discharge from institutions. Their data showed that people that typically come into shelters, homeless shelters, were pretty well known to the state's mainstream system. For example, they've included 18 to 24-year-olds that are aging out of state services, they've included ex-offenders released from state or county facilities with virtually no place to go after their release. They've also included people from detox programs at the beginning of their recovery. And they've typically included people with serious mental or physical illnesses that have been released directly from a hospital. These are the categories of people that typically enter our homeless shelters. Okay. So again, we have 18 to 24-year-olds that are aging out of state services. We have ex-offenders that have been released from state or county facilities with absolutely no place to go. We have people that are coming out of detox programs at the beginning of their recovery. And we have people with serious mental or physical illnesses released directly from a hospital. Now, if we think back, most of these categories of people would fit in with all the individual risk factors and system-based risk factors. So again, we're going to want to target the individual/system-based risk factors. We're going to zero in on the communities, so to speak, that possess those risk factors. And we'll typically find that they include the 18 to 24-year-olds aging out of state services, the ex-offenders released from state or county facilities with no place to go, people from detox at the beginning of their recovery, and people with serious mental or physical illnesses released directly from a hospital. Now let's take a look at some of the best practice strategies. Number one strategy that's been deployed has been to develop and implement system-wide policies that prevent discharges to shelters or streets. Again, we'd focus on the communities that possess the individual and the risks and the system-based risk factors, and we develop and implement system-wide policies for all those communities. We're discharging from either the hospital or from a detox program, from a state facility, or the 18 to 24-year-olds aging out of the state system. We develop a strategy to prevent discharge to shelters or streets.